friends. I'm Dr. Alice Pratima Michael. I'm here with you today again to talk about hormones, what happens when they're imbalanced, how to know and what to do when you have hormonal imbalances. The reason I wanted to bring up this topic is because over the last few weeks I have repeatedly seen many patients who has been confused with their hormonal issues, and of course some of them have done some inappropriate test packages, and then the treatments that was provided maybe sometimes was not as sufficient, because when you have an hormonal imbalance, obviously it goes to state that you need treatments with hormones. You can't treat it with just a vitamin supplement. So you need to know how to acknowledge and understand that you may be having some issues, so it alerts you to when to go and see the right kind of doctor, and then to be able to accept what the doctor suggests and to be compliant with the treatment, because hormones are so important. I always tell my patients hormones are what makes us tick. Okay, so without hormones we are not going to think the way we do, we're not going to look the way we do, we are not going to behave the way we do, we are not going to work the way we do, we're not going to have relationships the way we are doing right now as well. So then here's my favorite assistant to ask me some questions about hormonal imbalances and treatments.
Okay. Thank you for that, Dato. How do I know if there's something wrong with my hormones?
Well, you may just feel like different. Your responses to situations may be different. The way you feel when you wake up first thing in the morning, you may feel different. Some people may feel very fatigued. They had a good night's sleep, but when they wake up in the morning, they may feel very tired. Some of them, for no reason, they are resting and doing normal work, and then towards the afternoon, their energy starts to crash, and they can't think right. And in short, hormones can actually drive you crazy. You know, many people who are put under that label of psychiatric problem, or they need a psychologist to consult, actually have hormonal imbalances. So sometimes it can drive you crazy, and sometimes you can have lack of libido, sometimes it can be appearance of acne on your skin, it can be hair loss in your scalp, it can be unnecessary hair growing for female, for example around the mustache, the beard areas where you're not supposed to be having them. Or some people can also be having extreme amount of weight gain, and even by looking at somebody, the way they are gaining weight, roughly we can say what kind of hormone problem they are having. But this is a very special topic of mine, how I will coordinate or correlate how a person's appearance relates to hormonal imbalances. So just to make it short, other than what I say, if you are having loss of hair at the lateral corners of your eyebrow, okay, yeah, I know you all are thinking, hair transplant, go to Dr. Ellis or go to somebody else who's doing it. But it could be your hormones, it could be your thyroid, you know. You're just 30 years old, but suddenly your skin is looking all sagging. And I see a lot of young girls come to me and say that, I'm so slim, but why is my arm so flabby? You know, so then it could also be growth hormone issues. Okay, you have extremely dry skin and your skin is cracking and peeling and irritated for no reason. It could be thyroid problem, you're getting dark spots and white spots. It could be cortisol hormone problem. It could be weight gain around your lower tummy, in the thighs, it could be thyroid. Okay, you're having extreme amounts of muscle fatigue, water retention, it could be aldosterone problem, could be calcitonin problem. So and you're always moody, you know, you're reacting, is drama for everything. Somebody has to just say, hi dear, how are you? And you go, boo, why you ask me? Do I look so miserable that you need to ask me how I look, how I feel? Okay, that means you may be having cortisol problem. So there's, from our mood to our energy to the appearance, there's a lot of clues that the body gives us, and then we know we have hormonal imbalance and we need to be alert.
Okay, so having said all that, Dato, I do not need to ask what are the symptoms, or are you going to explain a little bit more? Because women usually have bloating, fatigue, hair loss, palpitations, mood swings, problems with blood sugar, and trouble concentrating, including infertility. Are these the most common symptoms that we can actually look for?
Yeah, let's start from a younger age group, because a lot of people think that hormone problems only happen when you're undergoing menopause. Okay, it's not true. I mean, you can have a very, very irregular hormone from very young in your life. If you're female, it can be from the ages of 10. It can be delayed, onset of your menstrual cycles, means you have very low hormone levels, or sometimes girls can have severe abdominal cramps, and heavy bleeding could also be hormonal irregularities. Okay, maybe we say between 12 to 15, the body is not mature yet, so you can have a little bit of irregularity, doesn't need to concern you. But if it is so severe that every time you have to take strong painkillers, it's good time to see the doctor, because there may be some irregularity, and if you ignore it, it can go on to become more serious issues like a polycystic ovarian syndrome, or actual polycystic ovaries, where you develop cysts in the ovarian area, and then you need very, very expensive surgeries and other things to correct it, and it may also lead to infertility. So again, I'm coming to infertility. Nowadays, people, when they find that they can't conceive, they straight away go in for an IVF. Okay, I have qualifications in reproductive medicine, and I've done a lot of infertility management during my time, and I find that, number one, before you go in for an IVF, you need to have your hormones diagnosed and regularized. Okay, if not, it's just going to be a lot of pain, a lot of money spent, a lot of mental anguish and stress when you straight away start on an IVF procedure. And as you know, IVF procedures, their success rate is not all that high. Okay, it's actually very low, somewhere between 2.5 to at the best 5% only. So if you straight away put yourself for an IVF without acknowledging that your hormones may be having some issues, then you will find that you will have a lot of miscarriage issues. You may get pregnant with whatever fertility pills and so on, but you can also miscarry, because your hormones need to be strong to keep your uterus strong to carry the baby that was implanted, the ovum, the egg that was implanted in you. So then all of this needs a proper, so why not go the correct way? The correct order is look at your hormones, do the ultrasound scans, find out what are the issues, correct them. This is my normal advice to patients. Correct them, try for a few months naturally, because the minute you go on to this stimulated egg production and everything, the stress goes up. Once you are stressed up, the body's ability to conceive goes down. So then you don't want to be in that situation where you're stressed out. If you really a reason for you to do an IVF, yes, of course, you should do it, but you have to go step by step. This is what I feel. So once you go step by step, you avoid a lot of problems and complications. Because I've also throughout my time seen women who gained a lot of weight because of their failed IVFs, and then because they gained so much weight, they could not conceive after that. So then they have to try and lose their weight, get their hormones back in order, and then they need to go to even naturally conceive, which has also happened when we treated some of the patients. So this is another case of young, healthy females who may be having hormone imbalance. Okay, and then again throughout our late 20s to early 30s, when we are studying, sitting for exams, I see a lot of young girls with menstrual irregularities, and this is coming not